The connection between alcohol and smoking, it's something that I saw before, but I'm always amazed. They just really potentiate each other, and they're really a marriage of addictions. And I do see really high rates of alcohol in our community, I think because we're isolated.
With being a co-occurring disorder facility, we deal with all the mental health issues as well as all of the drugs and alcohol. You can't separate them. It is one addiction. The same principles apply when you're quitting alcohol, drugs, whether it be heroin, cocaine, oxy, it's all the same.
Tobacco-free policies really make sense because it seems somewhat hypocritical to treat one aspect of a person's addictions and not another.
When I'm doing an assessment on a person, you know, and I've diagnosed them with alcohol dependence and nicotine dependence and polysubstance abuse dependence, I would hope that when they went to treatment that they would get treated for all of these things.
I think one of the things with substance abuse is that there are some people who feel like the brain changes that occur from using other substances, such as alcohol or other drugs, can in some ways be similar to the brain changes that happen with using tobacco. Some experts who feel that stopping all types of substance abuse, which would include tobacco, is important in recovering from substance abuse of other types.
People really aren't all the way free from addiction in their lives as long as that tobacco use is hanging on to them.
Tobacco use is often overlooked. It's kind of minimized as that substance that there's not really any danger to, or it's the least of all of the substances to really concern yourself about. People don't smoke a cigarette and black out and do something stupid.
There is research that shows that if the nicotine is addressed and treated, that the other addictions are more likely to also be treated successfully.
We tend to have a high mental health population here, and we do get people with detox issues. So they've got a propensity towards addictions. Because of that, you'll see a strong addiction towards nicotine.
One of the big things that we work with to help them is motivational interviewing, motivational therapy, to keep them motivated. The idea is to let them understand that they have the opportunity to quit while they're here, and we're here to support them.
You set somebody up in a hospital setting and get them started on a program with a patch and it's working and they're excited, and then you send them to a facility where they're working on their addictions, which is wonderful, but there's a trigger and there's other people who are smoking and they may not have the success to work on both addictions at the same time.
If they're allowed to use tobacco in treatment, every time that they light up in the morning, they begin their addiction cycle all over again.
I think it is such a wonderful thing if you can have a rehab facility or a mental health facility be smoke-free. It takes away distractions, and I think if you're changing one behavior, why not change all of them? Take the opportunity that's given to you to really work with your patients and help them be successful.
It helps them have an opportunity to see what that's like to be tobacco-free. And that's where you have to start.
It's the simple phrase that I love the best of all, which is, you don't have to quit right now. You can quit whenever you're ready, but all I can tell you is quitting is the single best thing you could do for your health. If they're interested, I give them information about the Alaska Quit Line, that everybody in the state of Alaska is eligible for free tobacco replacement. I give them some facts and pamphlets, and I encourage them to make a quit plan.
Each patient is different, so you have to explain it differently, and that's part of our art being caregivers, is to know what level to get on and how to explain it to them so they will understand it and not feel threatened or not feel shunned about what's going on, so they can get the information, provide the information, and hopefully they'll take it and take advantage of it.
I had a patient who was schizophrenic, obese, marginalized by poverty and social issues, and was able to successfully quit smoking and was really excited about it, and it started a bunch of other healthy trends in their life.
if that's the number one thing that kills people, then that needs to be a huge priority.
Nobody asks to be addicted to these drugs or the tobacco, but they are. And so it has to be something that the client can learn to understand and how to succeed.